So I think some of the common misconceptions that patients have is that it is an age-related thing, and it's not always an age-related thing. Anyone can have infertility of any age. And another thing that I think it's important for people to know and understand is when you're under 35, you really don't you're really not given a diagnosis of infertility until you've been trying actively for at least 12 months. Now that is without that's without other known causes. If you've been diagnosed for some other known cause. Well, I always want to discuss with patients that this is not a fault thing, that it's not their fault, it's not their husband's fault. It's just something that happens and can be dealt with and can be overcome in the majority of the situations. I always talk to patients about being patient with their infertility journey and having an open mind and having another backup plan in place, such as a surrogate or adoption. Well, this is a rough estimate, but about 25% of the causes of infertility in a couple are due to the male. About 25% causes are undetermined, and then the other 50 are female cause. So when we're talking about the infertility workup and diagnosis, the first thing you have to think of with the female is, are they ovulating? So anovulation or irregular ovulation is the cause. Another cause is tubal factor, meaning are their fallopian tubes open so that the egg can get into the tube and the sperm get to the egg for fertility. And then other causes are uterine causes, such as uterine anomalies or uterine fibroids. And then whether the eggs are, and another cause is whether the eggs are actually healthy or not. And that's more in your older age group patients. So as far as mental health, this is kind of a no-brainer, but it is important for patients to think about. So taking care of yourself, initially, primarily taking care of yourself, getting enough sleep, avoiding tobacco use, minimizing or avoiding alcohol use, and taking care of your own health first and foremost, mental health and your other health, cardiovascular, if you have diabetes, all of the other healthcare issues, making sure those are being addressed. And then emotionally, these patients do need a lot of emotional support, and they need a lot of understanding from their physicians, their healthcare providers, and their family that this can have a huge impact on the couple, not just the female, but on the male as well. I think that having a positive outlook is definitely a plus as they move forward in their journey, not losing hope. I think it's important that they feel comfortable with their providers, their infertility, reproductive infertility doctors, their primary doctors, and their other healthcare providers that are on the team. If they're not, then they should seek out those providers that they do feel comfortable with and they do feel like they're getting that support from. So the the frequency of infertility hasn't really changed. You know, that's been pretty stable over many years. It's just now more common and more talked about and more well known because of the technology that we do have and the group of patients that are trying to get pregnant that are in that older age group. They're putting pregnancy off because they're putting their careers first. So the rate of infertility is not higher. It's just perceived that it's higher. I think that some of the interesting technologies are some of the tried and true things. Your in vitro fertilization, your egg retrieval, your bank that you can, your sperm bank and your egg, and your bank that you can actually get eggs from, and then surrogates. So those aren't necessarily new technologies, but they are helpful and successful technologies in patients achieving a pregnancy, whether it be through their own genetics or through a combination of technologies.